Hi, my name is Laura. I'll be the nurse assessing you today. How are you doing?
Good, thank you.
It's very nice to meet you.
Nice to meet you.
First, I'm just going to give you a brief explanation on what I'm going to do today and kind of just give you a rundown. And that way, if you have any questions or concerns, you can go ahead and ask me. First, I'm kind of just going to ask questions about your family history, your own health history, and then I'll do some inspection and like palpation, kind of listen to your heart and make sure that everything's okay. Do you have any questions or concerns before we get started?
No.
Okay. Regarding your family history, do you have any history of cardiac diseases or anything like that?
Both sides of my parents, my father and mother.
Your father and mother. Okay. And can you give me a rundown on your mother's side of the family and what kind of happened there?
Well, I think it was her lifestyle. She had trouble with obesity later in life, and it started out with diabetes, and then it turned into heart conditions, problems, and then my father had kidney problems, and then that came, and then long after that came the heart problems. So.
Well, how old was your mom when she was diagnosed with heart issues?
I think she was in her 50s.
Okay, and what kind of symptoms did she have?
She had flushing in her face, and she had swelling and shortness of breath.
Okay. Does she have any history of like treatments or procedures that you know of?
Well, when she was in her 50s, she had her first open heart, and then when she passed, she had her second open heart in her 60s.
Okay. So ultimately, what was the outcome? What caused, her to get really
I think
bad?
it was more her lifestyle, although heart disease did run in her family. Her father, I'm not sure about her mom, but I know her father passed from heart disease.
Does it run in your father's family?
Yeah. His father passed with heart disease, and I think my father, it was more his lifestyle. When he was young, he drank a whole lot, and his kidneys had kidney failure later in life, and then heart failure.
Okay. Now I would like to ask you questions about your lifestyle, any changes that you've noticed in your own energy, and if you've noticed any weakness. So before we get started, do you have any questions about what we covered so far?
No, thanks.
Okay. Regarding your lifestyle, have you, in the last couple of months to a year, noticed any changes in your energy? Have you become weaker? Anything new?
The only thing I noticed is I have to watch my sugar intake. When I have too much sugar, and it has to be an excessive amount, then I have a little bit of shaking.
You have a little bit of shaking. Okay. Any other times that you have shakiness or other symptoms associated with that?
No.
What is your diet like?
I think it's pretty healthy over the past few years. I was conscious about what I ate and my exercise.
What do you do for physical activity?
I do a lot of housework, and I take care of the home with 4 people in it, and then I do a lot of yard work when it's spring and summer.
Okay. Do you watch your sugar intake, your carbs, your fats, things like that?
Cholesterol.
You do watch that. Okay, good. Have you ever had any cardiac procedures or treatments or tests in the past?
I had an EKG maybe 8 years ago, 5 to 8 years ago, and it was fine.
And do you know your labs at all in regard to?
No, I'm way overdue. I have an appointment in June.
Okay, that's good. Are you a smoker?
No.
Do you have a history of smoking?
No.
Any exposure to secondhand smoke?
When I was young, up to about 10 or 11, both my parents smoked. And then I wasn't around it as much when I was 13 and older.
Any history of alcohol use?
Yeah. My father more than my mother.
And what about you personally?
Not at all.
No?
No.
Okay, good. Okay, just a couple more questions. Do you have any history of being treated with anything regarding your heart? Any hypertension, high blood pressure?
Everybody diagnosed me with high blood pressure because my face was flushed once in a while, but it's been a long time since I had that.
Do you know where your blood pressure runs? If you've ever noticed that your blood pressure runs high or anything like that?
No, it's been a while since I really monitored it.
Okay. Do you have any chest pain or palpitations, skipping of a beat? How about racing of your heart? Any swelling that you've noticed? Okay. And any other lifestyle issues or things that have changed that you've noticed that I didn't ask you?
No, my only two concerns are the diabetes, because it runs in my family, and heart disease. So I have an appointment in June. So
Okay, great. All right. Now the next step, we're just gonna do a brief physical assessment. I'm just gonna take a look at your face, your neck, your chest area. Take a look and kind of examine you, listen to you, and just kind of feel and make sure everything is where it needs to be. Kind of get a better clue of your overall heart function and your cardiovascular system. Before we get started, I just want to let you know that I might have to have you sit and lay down and kind of just a couple different positions to get a good full examination. Is that okay with you?
fine.
Do you have any questions before I get started?
No.
Okay. First, I'm just going to inspect your face. And when I inspect your face, I'm just looking for good circulation, good color. And from what I've noticed, you're not flushed. Your circulation's good. Your lips look nice and pink. They don't look blue or anything like that. That would show poor circulation. So that's great. When I look at your eyes, I see that there's no swelling around your eyes. Your sclera is white. There's no redness or anything that would indicate a concern. Your face is symmetrical, it looks great, and now I have a couple of supplies here that I'm going to use to help with my examination. The first thing I have is a flashlight that's just going to help me get a better view of your neck and maybe just see if we can get a better angle of the veins. And then these rollers are going to help me measure something called central venous pressure to see if you're within normal range and where it measures on your body. And then I'm going to use my stethoscope to listen to your heart and different points, and kind of just we'll go from there, okay?
Mm-hmm.
Sound good? Alright, so first I'm just going to use this and I'm just going to examine your neck. Can you turn your head that way? I'm just going to move your hair. It doesn't look like your neck is distended or anything like that, which is good. Now I'm just going to take a look at your chest. Is that okay?
Mm-hmm.
So when I'm looking at your chest, I'm just looking for any pulsations that are visible to me. Then I'm just going to feel for pulsations and vibrations, and if it indicates any abnormalities. Does it hurt at all if I push on it? Is there any discomfort when I push on your neck? Alright, so now before I have you lie down, I'm going to listen to your heart sitting up. And I'm just going to flip the stethoscope and listen to it the other way. Okay. Now I'm going to feel your carotid pulses, and I'm also going to use a percussion technique on the different points that I can feel your pulses on your chest, okay? Carotid pulses look equal, they're regular. Okay, everything feels great. Now I'm just going to listen to your lung or your heart again, okay? I just have a couple more things that I'm going to do. This part, I'm going to measure what's called the central venous pressure, which kind of measures the amount of pressure that your heart is withstanding at one time with the blood flow that's going into it. The way that I'm going to do that is I'm going to use 2 rollers, and I'm going to put one roller right here. It's called the point of Louis, okay? And the other one, I'm going to find your internal jugular pulse, which is right there, and I'm going to measure how high up it is in comparison, which right here is measuring at 1 inch, which is within normal limits. The last thing I'm going to do is just listen to your heart one more time in all of the different locations. When reflecting on my exam and talking about your health history and your family history, based off of the fact that you do have a long line of heart disease in your family, it's definitely important to continue to watch your diet, stay active, and go to your doctor and get those checkups to have them monitor your blood pressure and your lab work. As far as your physical activity, it sounds like you're doing a great job staying active every day. And as far as your diet, it sounds like you're really watching what you eat and you're really making sure that you consume healthy, nutritional foods. The biggest thing I think for you is to definitely watch the candy and the shakiness, and if you start to get any new symptoms, to let the doctor know. Do you have any questions or concerns for me?
No, thank you.
Thank you very much for your time.
You're welcome.
Have a nice day.
Thank you.